fib fracture.
His bike's been dragged.
He's very severe.
His leg is extremely swollen. There's a build-up of pressure.
He's really not getting better.
He might actually lose the leg altogether.
You were by my side, came to my aid. Look inside my eyes and help me try to ease the pain. You're my lifeline, tell me it's gonna be right. You're my lifeline, reach out your hand, take mine.
Very worried for you, my friend.
The bone's been smashed to bits.
Whoa!
He's actually stopped breathing.
Clear.
Without intervention, he's likely to die.
It's better.
I need you to save me now.
Emergency Registrar Dr. Tinny Chang always knew she wanted to make a positive impact in people's lives.
My parents actually were quite worried when I told them that I wanted to pursue medicine. They said, it's a really stressful career, Tinny. I've never regretted my choice in pursuing medicine. Yes, there are some days that are quite stressful and challenging, but at the end of the day, knowing that I'm providing great care to my patients and I'm doing what I love makes all the difference.
Dr. Tinny's next patient is arriving in the ambulance bay. A 46-year-old cyclist struck by a ute with a serious leg injury.
That's it. Nearly there. Good job, Damien.
Let's just keep going across. Ready, set, go.
Perfect.
Okay, have we definitely called for a trauma alert and trauma the where?
Yes,
or?
we've got trauma alert put out.
Yep, I'll just call and just let them know. This is Tinny, one of the ED registrars. Just making sure you're aware, we've got a trauma alert currently in Resus 6 with an open tib fib fracture. We call a trauma alert for patients if we believe that the trauma is going to be quite serious and potentially life-threatening. Trauma's on the way, sorry, thanks for that.
The driver of the ute states that as he's hit Damien, he's noticed him to just go flat on the ground. His bike's been dragged, tib fib fracture to that right side. And speaking to the ute driver as well, said that he was conscious, screaming in pain. He's had 150 microgram of IV fentanyl, 200 microgram of IN fentanyl.
I'm worried he's been requiring quite a large amount of strong painkillers to get on top of his pain.
No other associated symptoms aside from the pain.
Hi, Damien. My name's Tinny. I'm one of the emergency doctors. We need to make sure that you haven't injured any other part of your body. I can see that you've got some abrasions to your face as well.
Paramedics have brought Damien into the ED lying on his side because it's too painful for him in any other position.
I know you're in a lot of pain at the moment, but it's really important that we actually try and get you lying on your back. We'll give you some pain relief for that, okay?
I can't lie me back.
I know. We'll give you some pain relief. We want Damien to be on his back. We haven't yet assessed to see whether he's got any other injuries to the rest of his body. He's clearly in a lot of pain. I know it's going to hurt, but it will be very temporary and we'll make sure you get some pain relief. Can we have a go at that, please? Yeah? I'll chart some fentanyl and morphine. Yeah, give him Panadol as well.
It's all hands on deck, with emergency Dr. Caitlin Young stepping in to help.
He did have a head strike and I can see that he's got some superficial abrasions just above, I think, his left eyebrow.
More pain relief's coming, mate.
Dr. Caitlin comes in because we're quite concerned about Damien's level of pain. We notice that his leg is extremely swollen and it's very tense on examination. This may indicate that something more serious is going on. We've just given you some pain relief, okay? You might feel a little bit funny, all right, darling? Okay, sorry, just keep your eyes closed. We're just trying to take out a piece of gravel. All right, there we go, all done, okay.
They're using a range of medications to try and get Damien's pain under control.
Does stretching your toes make it worse?
Yeah, feels, yeah.
Yeah. This compartment's very tense. When I press on the different parts of his leg, it does seem to be very tight. Damien's in such severe pain that it starts to make me worried about a condition called compartment syndrome. We just need to get him onto his back.
I'm drawing up the fentanyl now as well.
We're gonna try and roll you now, okay? You're gonna be okay, all right? Everyone ready? 3, 2, 1.
Yep. And roll.
Okay, and then rolling down, 3, 2, 1. Good, man, you're doing really well. Good job, good job.
going.
All right.
I'm just gonna lift this leg. We're gonna put a pillow under your leg. There's a time pressure in terms of diagnosing compartment syndrome, and the longer that it goes on for, the higher the risk of complications. When there's a severe injury, such as this broken bone, you get bleeding into the muscle, which subsequently means very, very high pressures, and the muscle tissue then not able to function properly and is dying.
In the middle of a busy shift, Emergency Registrar Dr. Terry Kane heads upstairs for a quick reset.
I love playing online chess. It just helps me decompress and switch off. And I play every time I'm having a lunch or dinner break. I'm a massive geek, a massive dork. I don't think it's a really cool thing to do. I think people will be more willing to go out for a coffee or a beer as opposed to sit down and have a game of chess. For me, it helps me realize how switched on I am. If I'm tired, I'm always losing. If I'm switched on and doing really well, then I'm always winning. So it helps me figure out if I need to pay more attention to things afterwards, I guess.
Dr. Terry is back on the ED floor, ready for his next patient as the paramedics call through.
We've got a 30-year-old gentleman presenting with left-sided chest pain.
They're bringing in 30-year-old Adrian, who's struggling to breathe and in terrible pain.
Is it still really severe?
Yes, it's still there. It's really good.
I'll go see him right now.
All good. Cheers.
I've been asked to see this patient who's been feeling quite short of breath and not really breathing deeply enough.
1, 2, 3.
So the concern is that there's something in his lungs going on that's causing him to be very unwell. Hey, Adrian, what happened? Lots of pain there
Yeah,
in your chest.
yeah. So
When did it start? Did it come on like that, or did it come on gradually?
it came on like that.
Yeah, sure.
This is not a new experience for Adrian.
He has a history of 3 collapsed lungs spontaneously in the past, last one being a year ago. Says that symptoms feel identical to the previous episodes.
What's the pain like? Is it like sharp? Is it an ache?
It's like someone stabbing me in the heart.
Yeah.
Yeah, from the inside.
Yeah.
How many times has this happened to you?
So like 3 times.
3 times.
2 on one side and 1 on the other.
So it's happened on both sides as well?
Yeah.
What caused it last time?
Not sure.
Yeah. The fact that he's had this 3 times before is a massive red flag. All right, I'm gonna have a quick listen to your chest. Do you think you can move your hand a little bit?
Yeah.
Thanks.
Oh, fuck.
Nice and slow, buddy. Sorry, you
I'm
keep going.
sorry.
Don't worry. Swear as much as you want.
I try not to.
So it seems like my going diagnosis is that he's got a pneumothorax, like air outside of the lung. And when that expands, it can compress your lung, and that can cause a collapsed lung, which is life-threatening, potentially. How's he breathing right now?
It's bearable.
Despite his difficulty breathing, Adrian wants the staff to know he's thankful.
All these are like literally lifesavers, so yeah. Doctors, nurses. But, I always wanted to be a nurse.
Did ya?
Yeah.
We'll give you some more painkillers in the meantime, all right? If you get worse, you can't breathe, can you please let us know?
Yeah.
I know it's difficult as it is, okay? We have to do an x-ray right now to see what's happening.
X-ray.
So it's significant.
Yeah. We can see immediately that there's air outside the lung. A pneumothorax starts off small, but it can actually expand bigger and bigger over time, and so it can get worse and worse. So if the oxygen goes down, he could become unconscious and he could potentially die from it. Hey Bjorn, I know you're just starting, but I might need some help with the patient if that's okay. I've got a guy with a spontaneous pneumothorax.
Dr. Terry is consulting with emergency doctor Bjorn Macon about Adrian, who's had 3 previous collapsed lungs and is now facing this life-threatening condition again.
So we've just got an X-ray up. I'm just trying to measure it. Based on this, it looks like it's 1, maybe 2 centimeters. The X-ray shows it's actually a small pneumothorax. So air outside the lung, if the pneumothorax became bigger, we would have to treat with a chest drain. It is where we cut into the chest wall and we put in a physical drain so it can have the air leaking out. It's really painful. It's a really difficult procedure, so we have to make sure his pain's really well treated.
The current guidelines would suggest that we actually don't need to do anything about it. I don't think we're going to intervene in this one unless we get pushed to, which would be him becoming hypoxic or this increasing in size.
The art of emergency medicine is knowing when not to do something. My initial response at looking at this chest X-ray is we should give him time to define whether or not we need to intervene.
We shouldn't do anything, which should resolve by itself.
Okay.
And probably needs a repeat chest X-ray.
Worried that Adrian could rapidly deteriorate, Dr. Terry keeps a close eye on him.
We just want to make sure you're comfortable, all right? So the pneumothorax is quite small, like I said. We're going to hold off the chest drain, all right? If you get worse, we might have to put one in, but I'm hoping that won't happen, okay?
I'm feeling a lot better.
Good, yeah. My concern is that when the medication wears off, you might feel worse. So we need to make sure you've got enough painkillers on board and we can make sure you're okay, all right? Is there anyone nearby that can look after you and stuff like that if we were to send you home at some stage?
Yeah, like my mum.
Sure, just because if we do send you home at some stage, it would be really good to have somebody looking after you just to make sure you don't get worse and stuff like that.
Yeah, that's why I actually wanted to call my mum.
Yeah, sure. Cool. All right, cool. I'll leave you in peace, all right?
Adrian immediately tries to get hold of his mum.
Mum? Oh, it went to voicemail. Sorry. Hey, Mum. It's 80. I'm just in the hospital, but I'm all good. So don't worry. I love you. I'll give you a call when I'm out. Okay? Love you. Thanks.
Being in the hospital could be really distressing, so having familiar faces and loved ones around you is very important. I think everyone needs their mum. How's your breathing doing otherwise?
It was good.
So when the pain was settled, you could breathe?
Yeah.
Yeah, okay. It's coming back up now?
Come back, yeah.
Yeah, sure, okay. We're gonna do another X-ray, but we'll sort out your pain first, okay? His pain is actually creeping back up, so it could be that the painkillers are wearing off, or it could be that it's getting worse. So I think I'm just a bit nervous and I really want to keep checking in on him.
A second set of X-rays will show if Adrian's lung has collapsed further.
Big press in, breathe away, all done.
As Adrian returns to the ED, Dr. Terry has the X-ray results, and they're not what he was hoping for.
Okay. Ooh, that's not good. Well, that's much worse than it was before.
We give him another 25 and 10 maybe of ketamine and 25 of fentanyl.
Dr. Caitlin and the team are treating 46-year-old Damien, who was hit by a ute and thrown from his push bike. He has an open leg fracture and is suffering intense pain that's increasing by the minute. The team fear Damien may lose his leg if they don't act quickly.
Damien's in such severe pain, and it is really not getting better with the pain relief that we're giving. And that is the most important sign that we have to indicate early compartment syndrome. It's a condition where you get bleeding into the muscle and very high pressure in that compartment, which subsequently means that the tissue is not getting the oxygen and nutrients that it needs. So we just need to order some X-rays.
If X-rays confirm compartment syndrome, Damien's life could change forever.
We'll get a shoot through his leg.
Sit back, please.
And then we'll get a better sense of what's happening with his pain. He's been pretty beside himself. The X-ray of Damien's leg confirms that the tibia and the fibula are broken underneath where this open wound is. I think he's got compartment syndrome.
Dr. Caitlin's worst fear is realised.
We need to make sure that this compartment syndrome is addressed as quickly as possible, because if we don't, it can lead to deformities in the leg and difficulty walking. But particularly because there's the wound overlying that, if that's infected, that can then lead to serious complications. Just going to lift your leg again, just a little bit.
You do have, a broken leg.
It is genuinely an emergency in that he must get to theatre and have this operated on as soon as possible. So we're gonna, next thing's our CT. So the next steps for him is to have a CT scan. We need to make sure that we're not missing other serious injuries that need to be addressed. Hey Damien, I'm Caitlin, I'm one of the other doctors. How you going, mate? I know you feel a bit funny from the medicine, okay? In terms of where we're up to, we need to do some CT scans so we can try and make sure there's no other kind of serious injuries to your head, chest, belly. Okay, but otherwise our main worry at the moment is your leg, okay? I'm gonna do an operation for your leg so that we can get the bones to stay in the right place and decrease the pressures in the leg, okay?
Knowing that Damien is facing an emergency operation, Dr. Caitlin is hoping to connect with a loved one who can come and be with him.
Do you know if anyone knows you're here?
I'm not too sure.
Bend your elbow,
Okay.
mate.
Oh,
You got any family, anyone you want us to call?
no.
Any friends or anyone you want us to let know? Or just talk to them tomorrow?
I can't think of the minute.
That's all right. We can talk to them tomorrow, okay?
Hey there, this is Tenny, one of the ED registrars. Just wondering approximately when you'd like us to bring him around. This is a time-sensitive emergency because as more time passes, the more pressure can build up. His leg may not get any blood supply and he might actually lose the leg altogether.
Damien, is it the pain? Okay.
Sorry.
No, it's okay, mate.
46-year-old Damien has compartment syndrome and is facing this trauma without family or friends beside him. He's in agonising pain, with the swelling in his leg building to a dangerous level. He urgently needs an operation after he was hit by a ute riding his push bike.
We're going to do a CT scan now just to assess for any other injuries. All right, how are you doing? Doing really well, okay?
Damien definitely needs an emergency fasciotomy where they actually cut into the fascia, the connective tissue that surrounds that muscle compartment. So cutting in releases all of that pressure.
Dr. Caitlin is worried about Damien's uncontrollable pain.
What's going on? Sore. Sore. Yeah, okay. Part of the reason it's so sore, I think, is those really high pressures in the leg, okay? Which is why we're organising for you to have an operation, okay? And that's why our medicines aren't working very well. Okay, you're doing a really good job though. It's always really difficult when someone's got severe pain because the first thing that I want to do always is try and relieve the suffering. For Damien, I know that the reason we can't do that is the compartment syndrome.
So CT said they'll be ready soon.
Sure. Can we give it another 10 actually? It's ketamine. We just make sure we've got everything ready to go to CT and also to go to theatre.
Damien heads to the CT scanner before being taken straight to theatre, where surgeons will try to save his leg.
You happy? I've got my phone.
Yeah, happy. Thanks, Kate.
There is going to be a long road ahead for Damien, and certainly one of the main risks for him going forward will be infection and complications along the way that can continue to give him trouble during his road to recovery.
My kids see this, they'll say, I want a Coke.
Emergency doctor Emma West is taking a quick break from her busy shift.
The emergency department is always a moving thing. There's always something happening. So to steal a few minutes for a break, it's really important to do. Because my break could be cut short at any moment, I really do go for something that makes me immediately feel good. Chocolate and nut bar, it's perfect. It's actually just my excuse to have chocolate.
Dr. Emma's break is over. Air Ambulance is bringing in her next patient, 72-year-old Bob, who came off his Harley Davidson.
He's come off his motorbike at high speed and he could really have any number of injuries. And it's a little surprising in his 70s to be riding a motorbike, but I'm sure I'll learn more when he arrives.
I'd ride a frickin' motorbike and fall off.
In acute pain, Bob's been given the green whistle, a powerful pain medication.
All right, ready, set, go.
You just concentrate on keeping your neck nice and still.
Okay.
All right, this is Bob. He was actually an aerobatic pilot in his past.
Okay.
Today, he was riding a Harley, doing about 80 Ks. The car did a turn in front of him, and he high-sided over the handlebars. Did pretty much land on his head.
He's actually projectiled through the air and straight into a mud bank. The force has gone through the top of his head. I'm so worried about a neck injury.
What we'll do is we'll say that you've got a neck injury until we have a scan that says you've not got one. Sound all right?
Yes, sounds like a plan.
Yeah, because then we can be safe for your neck, because it's pretty important. So I'm just going to have a look at the rest of you, if that's all right.
Yeah, go ahead.
Okay, any numbness or tingling arms or legs?
No, I just twiddle my toes, everything.
And just bend your knee for me. Yeah, perfect.
My next step is to determine whether he's got any neurological injury. Even something as seemingly insignificant as a tingling sensation can actually be impairment of your sensory system, which suggests that you could have a spinal cord injury.
The only thing I got is I had a little bit of tingling in this thumb here.
Yeah.
I might have hit the handlebar going over.
Yes.
But look, it's all right. It's not broken. Nothing. It's just.
Has it resolved the tingling, or is it still
No,
there?
no, it's gone.
Good, perfect.
He's a really joyful, humorous man. My hunch is that he's probably playing down some of his symptoms.
So squeeze my hand hard.
Worried about the impact to Bob's neck, Dr. Emma needs to investigate further.
What we're going to do is we're going to do a CT scan,
Okay.
and that'll tell us if there's an injury there. You need it regardless.
Put it this way, 73 years of age, soon early, and riding a frickin' 320-odd kilo bike. Oh, God.
I used to ride motorbikes, Bob.
Oh, yeah?
When I was little.
You enjoy it?
Yeah, I loved it. It was good. I had a house that backed onto the bush, and my dad always had motorbikes, and so we would ride in the bush.
I can understand his passion. He's out, wind in his hair, going fast, having an absolute blast and fun time. I think as an emergency physician, I have changed because I just know what can go wrong, but I admire him for getting out there and having a great time.
And so you've got a partner or a wife or something?
I've been married 52 years.
Yeah. Yeah, what will she say?
Pure panic. Get rid of that bike.
I can imagine that she's terribly worried every time Bob's out on his bike.
I'll just pass you on to him and have a chat then.
Bob's wife, Pauline, is eager to speak with her husband.
Hi, how are you?
I'm going to be late for dinner.
They might keep you in overnight, will it?
Just got a sore neck. The rest of me's okay. I'm on a lovely ride in the helicopter. I wouldn't panic, wouldn't rush in. I'm not going to die just yet.
Okay.
See ya. Bye. All right, love. Bye-bye. If you turn around and said to me now, well, your neck's knackered, you're never going to walk again this summer, I would be upset, but at the moment, everything's functioning. Everything's moving like so, and
Fingers crossed that everything's okay.
that's all we can do. That's all we can do. I'm more worried about my motorbike.
I'm more worried about him.
Ooh, that's not good.
Dr. Terry is looking at the chest x-rays for 30-year-old Adrian, whose lung is rapidly collapsing.
Unfortunately, all of this is air outside of the lung. Just push down all the way from there. Okay. I think it might need a chest drain, actually. Unfortunately, the fact that this pneumothorax is expanded means that we have to put in a chest drain. He's effectively got a collapsed lung now, and we need to act quickly on this. It's pretty big, isn't it?
Yeah. Well, so much for we're never going to have to do anything about this, huh?
I know, I can't justify not putting a chest drain in.
No.
But I'll have a chat with Spiritual, we can get started.
Excellent.
Having been through the painful procedure multiple times before, this will not be the news Adrian is hoping for.
My name's Bjorn. I'm one of the emergency consultants. The repeat X-ray shows that your pneumothorax has actually got quite a bit bigger.
What?
Yeah.
So, what?
We put the smallest needle possible tube into your chest. Try and suck the air out and let that lung re-expand.
Knowing that you're about to have some painful procedure that you're not going to have much control over is horrible, right? The job is not just to do all the medical parts, but it's to interact with people. You have to make that connection in order to be able to have somebody believe and trust you.
You've had this, what, this is your third time, or is it the fourth time?
The fourth time. They put a hole.
Can I have a look?
Yeah.
So we're going to use something much, much smaller. How does that sound?
Yeah, yeah.
Okay.
I like that idea.
You like that idea?
Thank you.
Okay, let me go and sort some things out. Okay, cool.
It is kind of a shock to me that I'm going to have to do it again, do surgery for the fourth time, which is great, you know, because it's going to save my life. However, I know how it goes, and yeah, it's not fun. But I'll soldier on and get it done.
His previous knowledge about chest strains is both a blessing and a curse because he knows what to expect, but at the same time, he knows that it's going to hurt.
Knowing what's ahead, Adrian has his own unique way of dealing with it.
He's meditating right now, and he's really controlling his breathing, so he's doing a fantastic job. I don't think I've ever seen anyone do that before.
As they prepare for the procedure,
Do you want to chart some ketamine so we can draw it up?
Dr. Terry has to leave.
What time do you have to go home?
10.
Of course, you have to go home at 10, right?
I was really hoping to stay and do it.
Because I feel like you made the diagnosis, looked after the patient, you had everything teed up, and you're not going to get to do the procedure, right?
I know.
Sorry. Go home and get some sleep.
Cheers, thanks.
Dr. Terry's shift has come to an end.
I'm back in tomorrow morning, so the finish line I can't help out with.
And Adrian is desperate for some relief.
Just kind of want it to be done so I can actually breathe, like, properly.
Can you do me a favour and just bring up his chest x-rays?
Dr. Bjorn is about to begin a procedure on 30-year-old Adrian to fix his collapsed lung. He starts with sedation and a local anaesthetic.
Adrian's pneumothorax has increased, and we now need to proceed with chest drain to remove that air out and allow the lung to re-expand.
I remember this part.
Just going to be a little sharp jab, okay?
Yeah.
Emergency nurse Lucy Stranger is assisting Dr. Bjorn.
You're okay. It's all right. It's okay. All good.
It's important that we make sure he's feeling safe, just reassuring through our voices, trying to get Adrian to a nice place.
You're okay. You see in the hospital. You're okay.
The better the experience will be.
Okay, air back.
We use a needle to introduce a wire into the cavity that we're trying to get to. I don't want to really advance the needle too far because then the risk is that I'm going to put the needle into his lung or into his heart or into other adjacent structures. I'm putting in a guide wire down the needle and get the pigtail catheter. There's a tube allowing us to remove that air out. I'd follow the path of the wire into that space and then pulling out the wire, leaving the pigtail catheter in place.
We're nearly done.
I'll stitch down the catheter onto the skin to hold it in place.
The tube will remain in Adrian's chest until his lung fully re-expands.
Okay, doc. Thank you very much for your help, everyone.
I'm waiting for the chest x-ray to make sure that the tube's in the right place and that the lung has re-expanded.
Can we just call for x-ray?
I'll give him a buzz.
Thank you.
One final X-ray will show if the procedure has succeeded in re-inflating Adrian's lung.
Look at that. Lungs are already up. So there's the chest tube sitting in the chest cavity. So you can see it's sitting nice and centrally.
I'm seeing a beautifully re-expanded lung. It's almost completely re-expanded. The tube's sitting in the right place.
So, successful procedure. It's good.
We've obviously dealt with the acute problem, but the next steps for Adrian are that he's going to be admitted under the respiratory team. They're going to involve our thoracics team, and together they need to decide what's causing the problem. They'll also decide how long the chest tube stays in place for, and manage any problems such as pain or infection.
I'll keep him spinally immobilised because of the neck, and I'll scan his spine because he's so sore.
Dr. Emma is worried about retired aerobatics pilot Bob, who flew over the handlebars of his motorbike, landing on his head.
How often do you do rides?
3-4 times a week.
Oh, wow.
Dr. Emma is focused on keeping the chatty 72-year-old as still as possible in case he has spinal injuries.
We'll do CAT scans and we'll find out what's wrong. If Bob's got an unstable broken bone in his neck, although he can move now, that could all change at any moment. So he has to stay still. I don't want that bone pushing on his spinal cord and resulting in paralysis.
Bob's wife, Pauline, has rushed in to be by his side.
Hi, how's it going?
Oh, going good.
Are you good?
You bring your stubby? Okay, Chris.
No, I didn't bring nothing.
How are you? Everything's moving, all my legs, feet and that. Just
Right.
waiting on the scans of the neck and let me know. I haven't broken a neck or nothing, I don't
Oh,
think.
you haven't?
Nah, I don't
Oh,
think
right.
so.
Oh, well, we wait to see what the test is.
Probably bruised it.
Yeah, at least you're still alive.
Oh, mate.
Bob's accident hasn't dampened his passion for his beloved Harley.
I'll be back on the bike again by the end of the week.
Oh, my God.
Emergency nurse Adam Mitchell is taking Bob to the CT scanner.
CT scan, mate. All right, mate. I'm all yours, brother. Rip up.
It can be quite daunting rolling up and into the CT. This is the moments where we're potentially going to find life-changing injuries.
Oh, it was just you in the accident? Yeah, but it wasn't, well, look, you don't call it an accident because I didn't hit nothing, but...
We're going to be having a look at your head and your neck.
Yep.
As well as your chest, abdomen, and pelvis area.
Okay.
A CT scan will reveal the extent of Bob's injuries from his motorbike accident. His wife, Pauline, knows all too well about his love of adventure.
I was thinking the worst, to be honest. He'll try anything. He was a pilot, private pilot. He's had boats, he's had guns, he's had dirt bikes, and now this road bike. His Harley Davidson is his baby. If he doesn't get back on his bike, my life will be hell.
1, 2, 3. Try not to move your neck for me, buddy. And back, 1, 2, 3. Try not to move your neck.
Yeah.
We need to make sure that he stays as perfectly still as he can, because if you do have some sort of fracture in your cervical spine, particularly if it's an unstable one, if you move the wrong way, you can potentially come across and shear your spinal column.
Dr. Emma is eager for Bob's scan results.
Can you have a look at his C-spine?
It's the worst kind of news.
C5, fracture. It's 3 column, unstable. Oh, broken neck. It's 3 column, unstable. Oh, broken neck, poor fella.
Dr. Emma is reviewing the CT scan results for 72-year-old motorbike rider Bob, who was involved in a serious accident.
Broken neck at about the level of C5, and it's an unstable broken bone. It's a big deal for him. There's lots of different parts of broken bone. It's actually really quite a severe injury, and the reason is it's just being held together. And so any movement, that's your spinal cord there, any movement can press on the spinal cord and you lose everything from C5 down, which is here down.
It's actually worse than I thought. So Bob has broken his neck in 3 places. I need to tell Bob, and I know it's going to be very confronting.
I can see a broken neck.
Oh, lovely.
Yeah. So at the level of C5, so you've got 7 cervical vertebrae, they're the ones in your neck.
Yep.
And number 5's not great.
Right.
And it's broken in a few places.
How long have you been here for?
A little while.
So I won't be riding my bike on Tuesday then?
Not on Tuesday.
Oh, bugger.
You've got good people looking after you.
No worries.
Yeah, they're gonna help you out.
The first person Bob calls is his wife of 52 years, Pauline, who's now at home waiting for news.
I've broken a bone in my neck. Yes. So I'm not going to be a paraplegic or nothing, but it's just going to take a while for my neck to heal now.
The next step is to arrange the teams that will look after his broken neck. Bob will meet the spinal surgeons and have an operation plan to stabilise his neck.
You're about to go up to the ward and you've had all your scans and it's only the neck that we're really worried about. I'll follow you up and see you get better.
Oh, I'm glad to hear that. Bloody hell.
Bob's future is now in the hands of the expert spinal surgeons.
The spinal team have been able to review his scans and they're really worried about him. So they're going to arrange an operation.
Am I going to stay in this hospital or move out?
You're going to stay here.
All right.
Let's go.
I think Bob's positive attitude will help him enormously in his recovery. He's going to need his whole personality to really get through what he's going to face. But if ever there's a man, it's Bob. He's the most positive man I've met in a very long time.
In the middle of a non-stop shift, new emergency registrar Dr. David Sparkhall is grabbing a quick cuppa.
I'm originally from the UK. I came across in 2019, originally planning to work in Australia for 6 months and get some money to go travelling. But then just fell in love with the city and the people here. I really enjoy coming to work. It's a really, really nice group of people here at the Royal Melbourne, and that's just a really nice environment to work in and pushes you to be better constantly, which is exactly what you want.
Royal Melbourne receiving.
We have a 36-year-old male with us. He has a 50mm nail to his lumbar region in his spine. We have images from the urgent care, so we do know that it is in the spinal cord canal.
I'm very happy to run that one and lead it.
Dr. David takes the case and immediately briefs his team.
So you guys have to do primary survey, spinal proportions.
We'll get some pain relief.
Yeah, sounds good.
A nail in the spinal canal is potentially very dangerous, both from damage to the spinal cord directly and from introducing infection into that space, which can be very severe and life-threatening.
Just arrived? Perfect.
Father of 3 Thong was working on a building site when the freak accident happened.
Okay, stay nice and still, okay?
With a 5-centimetre nail piercing his lower spine, any movement could be catastrophic.
Let's be really, really strict with our spinal proportions as we go across.
Don't move, okay? Everybody ready? On go, ready, say go.
Good work, team. Okay. Are you in a lot of pain at the moment? No. Not too much? All right.
This gentleman was on a building site today. He's had a single nail into his back from a nail gun.
Take some deep breaths, breathe in.
His friends have then carried him to the car, carried him into urgent care. He's not been able to wait there at all and collapsed to the ground.
All right.
My friend, he walked in my back side. When I stood up, I think I touched the gun.
We see a lot of traumatic injuries, workplace accidents. I can't say that I've ever seen a nail gun to the spine before.
I have a wife and then 3 kids. Yeah, I already called my wife. Yeah, they're coming now, I think.
Until Thong's wife arrives, he's dealing with this horrific accident all by himself.
It's got to be quite a scary thing to have this kind of injury. Some people are sort of stoic and keep very calm on the surface. Our priority is just making sure that he feels comfortable and knows that we're going to do everything that we can for him.
Can you feel this? Is that normal? Normally,
The team immediately check for any loss of movement or sensation.
Yep.
It's really important to do a neurological assessment to characterise what structures have been damaged by this nail.
Push down into the bed. Good.
Any kind of penetrating injury to the spinal cord can potentially lead to irreversible damage, so paralysis is a risk.
Lift this leg up straight. Good. Lift this one up straight.
Dr. David urgently needs orthopaedic registrar Dr. Patrick Elias to look at the scans that were taken at the medical centre.
The nail has somehow found a pathway through a joint to end in one of the most serious parts of the spine, which is the spinal canal near the nerve root. So there's a chance that there's some damage to the outer cord or the outer coating of the spinal cord.
While they assess the scans, Thong's wife and best friend arrive.
Okay. Get you some tissues. Yeah, it is hard. Yeah.
Hello, I'm Patrick. I'm one of the orthopaedic doctors.
Having seen the scans, Dr. Patrick now needs to see exactly where the nail is.
Can I have a look at your back? Is that all right?
Yes.
Having a close look at the injury is really important. We're looking for any active bleeding, we're looking how much of the nail is still sticking out through the skin, and whether there's any significant swelling or hematoma building up that might need us to act urgently.
On my count on 3. 1, 2, 3.
It's gone right through. It's gone right through.
Yeesh, that's hectic.
Dr. David and the team have just taken their first look at the 5-centimetre nail which was accidentally fired from a nail gun into Thong's spine.
I'll put a dressing on there just to cover it.
That nail has gone really far in, through the side of his vertebral column and through some of the joints holding the vertebrae together into his spinal canal where all the nerves are. Thankfully, at that point of the spinal cord is divided up into lots of small strings rather than one big piece of rope. And at that kind of level, something coming in can often push those little strings aside rather than cutting straight through the middle of it. He is very lucky.
As remarkable as it is that Thong has not been left paralysed, he's now facing a dangerous operation.
So the plan will be to take it out in the operating theatre and then also make a bigger cut and wash the spine, and we'll give you some antibiotics. Now, when we take the nail out, there's a chance that some of the nerves could be damaged as we do that, but we'll do our best to prevent that. Okay?
As with any surgery, there are risks. Anytime we're moving that nail, there's the risk of causing further damage to the nerves, but we've judged that the risk of removing it is less than the risk of leaving it in there.
It's a lot for Thong to take in.
How are you going?
Yeah, small pain.
Small pain? Okay. Let's get you some painkillers because it can't move around a lot, so we don't want you getting stiff and sore. Now, have you got any questions at all?
I'm hungry. Can I eat tonight?
Thong is facing major back surgery, and his concern is whether he can eat or not at the moment. I'm not sure I'd be the same in his place, but clearly he's quite a stoic man.
Do you want to sit up now?
Yeah.
Okay.
Until he's had the surgery and we've reassessed him afterwards, we won't know for sure what the damage is going to be and how much rehabilitation he's going to need. Hopefully, he hasn't got any long-lasting damage. All our fingers are firmly crossed here.
Dr. Tinney and Dr. Caitlin treated 46-year-old Damien, who was knocked off his push bike by a ute.
Open tib-fib fracture.
In excruciating pain, Damien was diagnosed with a limb-threatening condition called compartment syndrome and was immediately prepped to go to theatre, where surgeons tried to save his leg.
We just make sure we've got everything ready to go.
After 2 operations, Damien is walking again and attending regular rehabilitation. 30-year-old Adrian was rushed to the ED in pain and struggling to breathe.
It's like something stabbing me in the heart.
Yeah.
Yeah. From the inside.
Yeah.
Adrian's lung had collapsed for a 4th time, and Dr. Bjorn needed to perform a delicate operation to reinflate his lung.
Look at that. Lungs already up. So, successful procedure. Good.
Adrian spent a week in hospital.
I had to have another surgery because the doctors, they wanted to glue my lung to like the inside of my chest wall.
He remains positive that both lungs will eventually be working properly.
They're talking about doing on the other side, which I'm happy to do. If they look after me, like fix me up really good, then that means I never have to come back.
Adrian is philosophical about his future.
In the midst of great pain, you kind of find out who you are and what you're thankful for. And I already love nurses and doctors. I'm going to walk out here just thankful.
Don't move, okay?
Father of three Thong was brought to emergency after a 5-centimetre nail was accidentally fired into his back.
Yeesh, that's hectic.
Dr. David and Dr. Patrick were relieved that the nail had not severed his spine, but he needed complex surgery.
The plan will be to take it out in the operating theatre. Now, there's a chance that some of the nerves could be damaged as we do that.
The next day, Thong had an operation to remove the nail.
Thung had his surgery, which all went well, thankfully, and there was no further damage to his spinal cord or nerves. And he walked out the hospital himself 3 days after he came to us in emergency, which is really nice.
72-year-old Bob was choppered into ED when he was thrown headfirst off his beloved Harley-Davidson motorbike.
I'll keep him spinally immobilised because of the neck.
Dr. Emma feared Bob had damaged his neck and spine.
C5, fracture, 3 column, unstable. I can see a broken neck.
Oh, lovely.
3 days after major surgery, Bob is recovering.
It's my first day out of bed, but I've had the neck operation because they found out I had more wrong with me than what we first thought. I had a broken neck, 2 broken ribs, and a broken back. So they fixed my neck up, put a metal rod in it. Just got to keep this on for 6 weeks.
But nothing will keep this daredevil down.
Yeah, no, look, it's all good. I've been walking around now. I do a little bit each day, a little bit more each day.
So he can get back to doing what he loves the most.
As soon as I get the all clear to take this stuff off, I'll be back on my bike.